I want to get a little context now on the healthcare aspect of this, because at its core, this is a public health crisis. Dr. Arghavan Salles joins us now. She is a surgeon at Stanford Department of Medicine, joining us to give us a little bit of context on the developments of the day and what we've heard from the president and the coronavirus task force. So Dr. Salles, I believe, is joining us now, if we can get her up and ready. Obviously, a lot of questions about Dr. Salles. There you are. Good to see you. Thanks for being here. I appreciate your time. A lot of questions for you. Obviously, this is a very tenuous situation across the country. There's been a lot of pressure on states that have been slow to close down and say everybody who is not an essential worker needs to stay home. We watched Georgia and Florida's governors sign orders today and yesterday. Still several states outstanding. Should every state in the country be locked down to some degree?
I believe so. I mean, we know that we don't have a lot of tools right now to fight the coronavirus or COVID. We don't have a vaccine. We don't have any treatment that we know is going to cure, quote unquote, cure the virus. But we do know what works is staying away from people who you can catch the virus from. And what we also know is that we don't know who you can catch the virus from, because a high proportion of people who have it are asymptomatic, meaning they don't have any shortness of breath, they don't have a cough, they don't have sore throat, they don't have fever. So I think we kind of have to assume that most of the people around us have caught it, and we need to act as though we don't want to get infected ourselves.
The president had said, again, that we've done the most tests. Again, sheer number is highest, but per capita is not. We're far from leading the charge there. What's the value of having broad testing across a population, of being high in the per capita testing range?
Yeah, testing would help us immensely in knowing, as I just said earlier, we don't know who has the virus. And testing would help us to know that. That would help us to know who we need to stay away from, who needs to be in isolation. It would also help us to know, once those people have recovered, whether they may be able to re-enter the workforce, and we could maybe start to kick back up our economy a little bit. But right now, without any idea, or I should say very little idea of who has COVID, we're left with this strategy of everyone just stay home. So without testing, we can't track who has it, and we can't track who they might have given it to. If you look at the countries that have had really great success in what we call flattening the curve and decreasing the number of, or the rapid rise of infections, they have done this by testing and then tracing the context of the people who are positive. Without testing, we simply can't do that here.
Again, we're still monitoring this news conference that the president is holding at the White House. There was some reporting shortly before we went into it, Dr. Salles, that the guidance would change, and that the White House is perhaps entertaining the idea of telling all Americans to wear a face mask in public. The president, in getting this question shortly after we dipped out, said that he doesn't think it'll be mandatory because some people don't want to do that. Level set for us on the benefit of wearing a mask. There has been a lot of conversation about whether or not a mask actually helps protect you from catching the virus versus helping slow or stop you from spreading it to other people if you have it and you're wearing a mask. What's the value of having a mask on, and in your opinion, should everyone be wearing one?
Yeah, I think the value, and by the way, I heard the same thing you did, that the CDC is going to be recommending that. I guess we'll wait and see if they officially do or not. But the value is, or the hypothesized value is that if you are wearing a mask and you're going out in the world, it will slow down your ability to spread infection to other people. Why that matters is that, as we talked about already, a lot of people who have a COVID infection do not know that they have it. And so I could have it. Literally, I'm sitting here, I feel great, very healthy, but I could have it. And I go to the grocery store and I could pass by somebody in an aisle. And if I sneeze or even just exhale close to them, then the particles we think are in the air. So the idea is that if I'm carrying it, that would decrease my chance of it passing it on to people around me. There are other nuances, obviously, which is part of why this hasn't been adopted. One idea is that if people are wearing masks, they think they will be invincible and that people will start to go everywhere all the time. And of course, we don't want to do that. We want people to continue to shelter at home. And so it's important to understand that, as you asked, I don't think the mask is designed to prevent you from getting it. And by the way, we have a supply issue, as was discussed in this press conference. And nobody that I've seen yet is recommending that people in the public wear surgical masks or N95s. The suggestion that I've seen floated is that maybe people should wear cloth masks or masks that they make themselves, because we need to preserve the surgical masks and the N95s for our healthcare workers.
So just clarify for me, the N95 masks protect healthcare workers primarily, but anybody who's wearing it, from breathing in particles that may contain the virus. Is that accurate?
Yes, that's accurate. So the N95 has smaller pores, as in smaller holes through which particles can get through, than does a surgical mask or cloth.
Okay. Okay. So as far as the supply chain, which you mentioned there at the end, obviously recommending that everyone in the country wear a mask would have to probably come with some stipulations about what kind of protective gear we're talking about, because healthcare workers are seeing such a shortage of N95 masks. From where you sit, what's still necessary as far as getting healthcare workers, hospitals, what they need to give people the care they need? I mean, we just heard quite a bit of time the president spent on talking about the supply chain and states talking about bidding against one another. I mean, what do hospitals and healthcare workers need?
Yeah, I think there's been, rightfully so, a lot of attention so far on masks and gowns and face shields, which we definitely need. And now we saw today in this press conference a lot of discussion about ventilators, which we also are going to need. And in some places like New York already very desperately need. Whenever patients are sick enough to be in an intensive care unit, there's a whole host of other supplies that we need to take care of them. So we're starting to hear now about medication shortages. So there are certain types of medications that we use to keep patients comfortable when they are on life support. Those medications are the next thing that we're at risk for not having enough of. Then if you go back further than that to what else goes along with that kind of care, we have there's suction tubing that's used to clean out the breathing tube. There's everything that healthcare workers are using to provide care in those contexts that also can end up being in shortage. So I think that we really ought to be looking, yes, at masks, yes, at ventilators, but also what else goes along with intensive and critical care? And can we make sure that we start ramping up production of those things now before we end up where we are with the mask situation right now?
Dr. Salles, I really appreciate your insight. It's helpful when we listen to these officials talk about information that sometimes is disputed with reports, sometimes is information that's addressed in long run-on sentences, and we need you to help us understand what's important here. So, Dr. Arghavan Salles, I really appreciate your insight. Thank you very much.